We have a developing story tonight as we continue to follow the upheaval at Lutheran Health Network. In the past several months, a group of doctors tried to buy out the hospital but failed. The CEO was let go, and several physicians resigned from key leadership positions. Officials from Community Health Systems, which owns Lutheran, have been silent until now.
Yesterday, Mike Poore was officially named the CEO of Lutheran Health Network. Today, he sat down with us to talk about the challenges he's facing, including morale, public perception, and the loss of physicians and board members.
You've lost several. Obviously, some of them have been let go and some of them resigned on their own. What kind of concerns do you have about that? Because some of them were very prominent Lutheran leaders. One
of the things I want to make clear is we haven't lost any physicians. We've lost physician leadership in leadership positions, but those physicians are still at our hospitals, still taking care of our patients, and actually we have a net positive amount of physicians. But you know, it's actually a good point. Those leaders, I didn't have an opportunity to get to know them very well, but I know that they are very prominent in the community, and they're involved in a lot of different things. So it is a loss. I hope to be able to build relationships with those folks.
One board member specifically reached out to us and said he had concerns because he felt like he wasn't being heard and that his opinion wasn't being valued. What would you say in response to that?
It's what I've said over and over again. I'm not asking anyone to trust me. I'm asking them to let me earn their trust. And I do that through transparency, through communication, and working with the people and showing them that I do what I say I do.